इसमें क्या होता है, when we are pressing, throwing our hands back, don't throw it like the bowling करता है ना, इतना force से bowling करता है, not like that, just swing very easily, we have to swing. ओके, सो इनिशियली जब वो बता रहा था, प्रसाद जी ने बता रहा था, व्हेन वी आर learn from there are available without raising the, so one variant is say you are later as you go to banish or reduce rhythmic way, you so can do the swinging of your arms. Here actually I am swinging slowly, it's not very fast. Okay, when we do the very fast swinging, what happens, we get the shoulder pain is likely to get here in this area. If you are throwing it here, we get the pain, or even in the fingers maybe. Fingers में भी क्या होता है, थोड़ा नर्वस ये हो सकता है, यानी नमनेस भी
झंझनाहट
हो
हो
सकता है.
सकती है, झंझनाहट.
Yeah, Janjanana. So do it slowly, enjoy it. It's all these things with enjoyment, with pleasurable pain, as what I said, pleasurable pain, and we are doing with enjoyment. All these things we are doing it. Okay, and do it not by force. Don't throw it back with full force. Just go up and bring it easily and do it. Okay. अगर बहुत लूज करे तो इफेक्ट नहीं होता है, थोड़ा थोड़ा कुछ पुश करना चाहिए, थोड़ा इफेक्ट करने के रहने के लिए. और जब और एक बात बताया था प्रसाद जी ने, जब आप 200 यू कैन नॉट डू 200 यानी 50. अगर आपको ये प्रॉब्लम, मेन प्रॉब्लम अभी काफ कोल्ड या किसी का प्रॉब्लम कम होना चाहिए, तो थोड़ा ज्यादा ही करना पड़ेगा, थोड़ा कंफर्ट जोन से ऊपर आके करना पड़ेगा. खाली 10 से, मैं किसी लोगों को बोला था 10-15 से शुरू करता हूँ बोला था वो लोग, लेकिन वो शुरू भी नहीं हुआ. 10-15 से कुछ फायदा भी नहीं होता है. ओके, सो दैट इज समथिंग लाइक 4 स्टेप्स. 10 कदम हम घर में इधर उधर जाते हैं, ऐसा ऐसा कुछ करते हैं, अलमारा से कुछ लेते हैं, पूरा ऐसा लगता है. थोड़ा करने से थोड़ा फोकस रहना चाहिए. एटलीस्ट स्टार्ट विथ 25 to 30, मिनिमम 30-40 तो स्टार्ट करो, यानी एक डायरेक्शन में 30-40, एंड दैट मीन्स 150 or 150 to 200. That's why I told the count of 200. ओके, सो मिनिमम करने से थोड़ा जल्दी इफेक्ट आता है. तो बहुत हल्का करने से और बहुत कम करने से इफेक्ट नहीं होता. थोड़ा the problem is coming because we are in the free zone. We don't want to take the lot of effort, we don't want to put. Okay, that is the clarification I wanted to give. Yeah, that is, thanks for sharing, Prasad. I take that caution normally, I apply and I tell the people also, and I make sure that in front of me 10 to 15 they will do it. Okay.
Yeah, to begin with, just I told to get
Yeah, I know.
so that
I
it
know
will
that,
be
yeah.
easy to increase. That's it. और कुछ नहीं है, क्योंकि
hearing improvement and eyesight improvement. Okay, with acupressure we are doing that, but it is self help again, और अपने आप कर सकते हैं. हम दिखाते हैं कैसा करना है, लेकिन उसके साथ पहले आपका आई का रीडिंग लेना है, बाद में हम बताते हैं एक्सरसाइजेस क्या क्या है. एक हफ्ते में एक बार मिलके कैसा कर रहे हैं मालूम करते हैं, देखते हैं, मॉनिटर, वे मॉनिटर कैसा, हाउ दे आर डूइंग द आई एक्सरसाइजेस. एंड हियरिंग आल्सो इज सेपरेट. फॉर एज अबव 40 years, 50 years, हियरिंग भी कम होता रहता है. So that means the reduction in the hear loss, and then the people will go for the what you call the hearing aid. Now we came out with the solution for this reduction in the hearing problem. What with acupressure, it's a 3 to 6 months it will take. Okay, more than 1 year also it will take. But there are cases where they have removed some 70 years old people, they removed the hearing aid after doing this acupressure. Similarly, for the eye exercises, for the children up to 20 years, it is very fast reduction. In the sense they can remove the specs very easily within 6 months to 8 months time, depending upon the point how much it is. यानी पॉइंट कम होता है बच्चे लोगों को, और द शरीर भी नरम होता है, हीलिंग भी बहुत ज्यादा होता है, जल्दी जल्दी होता है, हीलिंग भी जल्दी होता है। वो लोग स्पेक्स रिमूव कर सकते हैं, विजन इंप्रूवमेंट जरूर होता है वो लोगों को। मैंने खुद किया था, मेरा 4.5 है, लेफ्ट का 4.5, राइट का 4 था। 1 साल करने के बाद आक्यूप्रेशर पॉइंट्स फॉर आई साइट इंप्रूवमेंट आफ्टर 1 ईयर, इन दोनों आंखों में एक पॉइंट रिड्यूस हुआ। दैट मीन्स 4.5 to 3.5 and 4 to 3 it has come down. I am wearing the specs that is what you call the up and down. It will vary. That is kind. That's why I'm using the same specs. I see like this. Now my near vision has improved after doing the exercises. I am reading like this with by removing the specs. I am reading. So eye
सर
exercises are
आई
focused.
के पॉइंट्स तो यहाँ पर बताए थे ना सर आपने, तो फिर यहाँ पर ऐसे करना है?
No, there are various other
अच्छा,
points. There are. I'm going to come there points. There are here, but I am. This is actually paid program. Okay, so
ठीक है।
because that requires more focus, we are doing with the acupressure and acupuncture academy. ओके, हमारा गुरुजी जो बताया था, भोजराज, डॉक्टर भोजराज बोल के, वो शुरू किया था। ही इज चार्जिंग सम 4-5 thousand rupees फॉर
ओके
दैट
सर,
वन,
ओके सर।
and I can do it. I can do, but that is a paid program, a research program, and then if you do it free, there will not be interest in the people. If we charge more money, they will not come forward. They will prefer to wear the specs by spending some eyes and their own thing. And I also wanted to announce for the elders. अभी 50 साल के ऊपर जो भी है, if they learn the ear acupressure, it will help a lot for those people also. They can remove their tinnitus. कानों में साउंड भी आता है, टिनिटस बोल के, उसका भी सोल्यूशन है। जो पॉइंट्स मैंने बता रहा था, अभी बताने जाने वाला हूँ, उसमें भी थोड़ा पॉइंट्स है उसका।
ओके सर, एक मधुलिन मैम का था, एडी यानी
हाँ,
हील में उनको दर्द रहता है,
ओके, हाँ।
तो उसके लिए अभी बताएंगे या मधुलिन मैम?
Yeah, I think that is zone therapy and swiso and foot reflexology.
तो कितने कितने मिनट, 5-5 मिनट ऐसे?
The reflexology तो 5-5 मिनट का ही है, एक फुट 5 minutes you can do that. I'm going to share it in the slide. And zone therapy तो कम से कम वो भी 5 मिनट, एक 14 times one has to do. Then swiso exercise she has to do. It is a must because that comes because of the uric acid accumulation, etc. So that we have to do to reduce that uric acid and all, and take lot of fluids. फ्लूइड डाइट मैंने बता रहा था ना, किसी पेशेंट गार्ड को बता रहा था उस दिन।
हाँ, कोतमीर का
फ्लूइड्स,
जूस और मोरिंगा का।
जैसा मोरिंग। सो जूसेस लेना चाहिए, ज्यादा जूस ले तो किडनी का फंक्शन भी इंप्रूव होता है, यूरिक एसिड वगैरह क्लियरिंग जल्दी होता है। ओके, सो एनी अदर, शैल आई मूव ऑन?
या प्लीज मूव ऑन।
People are asking the question. I just wanted to slice a minimum 200 to maximum 1,000 people have to do for better health and improvement. So if you are doing less than 200, you are in a comfort zone. Unless you come out of comfort zone, it is difficult to solve the problems. Okay, foot reflexology 5 minutes and each foot once a day. Hand reflexology 5 minutes each day, each hand and once in a day. And zone therapy, hand, fingers, and toes once a day, 7 times each finger for the toe. And for well-being, that is for जो भी पूछा था अभी, 14 times the uric acid होता है, the heel pain के लिए 14 times press करना है। Okay, so well-being points 7 times acupressure for prevention, 14 times curative. Then no overdoing of acupressure. If points are tender, give rest and skip. So what we have to do, the no overdoing means हमेशा एक बार कम हो गया बोल के पूरा दबाने से, ज्यादा एक्टिविटी, ज्यादा एक्सरसाइज करने से ज्यादा इम्प्रूवमेंट नहीं होता है। उसका भी बॉडी का हीलिंग होने के लिए भी थोड़ा टाइम लगता है, वक्त लगता है। ओके, सो देन व्हेन टू डू, बिफोर meals or 1.5 to 2 hours after the meals one has to do. And then 6 a.m. to 6 p.m., 6 a.m. to 8 a.m., or 6 p.m. to 8 p.m. That body energy, as I mentioned, yin and yang energies will be equal in the body. That time is suitable for that. Or if nothing is possible, you can do it in the as per your convenience, as advised by the specialist. Okay, so this is the schedule one daily routine for well-being. Okay. I think Madhulini madam, that solves your thing also. So your doubt also, I think it will be cleared. So how to do, when to do, how many times to do, etc.
Thank you,
Okay.
sir.
Okay. So now the most important is when we get this heart, the most people will see this, the heart attack problems and the heart problems, etc. Okay. So the point what everybody should remember is H9. Last time also I was mentioning this. This is a takeaway for all the people daily. If they do it, it will be very useful for as a maintenance of the health. Very important acupressure points. Acupressure मेरिडियंस का बारे में अभी मैं नहीं बता रहा हूँ, क्योंकि ये पूरा मेरिडियंस है इसमें. It takes a long time to explain all these meridians. There are 14 meridians in the body. Okay, so the energy goes from one point to the other point to the up to the organ level. Okay, so just I will show for the sake of heart meridian कैसा होता है, इधर से होता है. You can see this heart 9, heart 8, 5, 4, 3, 2, like this it goes the meridian. It is called the energy channel. When we call it the energy channel. Similarly, this is a small intestine. It keeps growing like this from the outside of the. This is a small finger का अंदर का है heart. Nail at the base of the nail inside. Small intestine comes outside of the in small finger outer the nail base. Okay, so that is the farak hai, the dono mein. So like this, no, the meridians keep flowing from here. This is triple warmer and pericardium meridian. Okay, triple warmer bole to is vata pitta kapha, and they have lot many points here in this one. So, and pericardium is the one above the heart, around the heart. There is a protection to that. So this also will help a lot in doing removing the heart attack or preventing the heart attack, etc. Then we discussed about the lung, and we are going to discuss large intestine and lung meridians. So whenever there is this is a large intestine. This is large intestine meridian. It is going from here. That is from the index finger, and this is the lung meridian is going from the thumb. This side, outside of the thumb, it is going the nail base. Then spleen and the liver. This is liver 3 is very important. So liver is coming from the outside of the big toe. Spleen is coming from outside of the big toe here. You are able to see this. So in this area it is coming. Okay. So outside of the big toe, first toe, this one. Yeah, ऐसा जाती है meridian पूरा up to the spleen here. One meridian goes up to the spleen, and on the right side it will go up to the pancreas, and then it gets into the lungs level. And here this is a liver meridian. LR is a liver meridian. Other side of the toe hota hai. That some pictures I am going to show exactly the location where it is. So this is a lung meridian, liver meridian. It will start from the root of the nail of thumb, big thumb, and it will go inside like this. And here this is stomach meridian. It starts from the second toe and goes up to the big. This one, this has many points here. Okay. So then this kidney and gallbladder meridian. Like this, it goes kidney meridian. Okay, it starts below this one. This is number 1 point here. The kidney ka foot ka niche hota hai. Ye point we are pressing in the reflexology point. Okay, in the reflexology we are pressing the points. And when we are saying the zone therapy, in zone therapy also we are pressing each and every point of the beginning of these meridians. We are pressing beginning or end, because some meridians are coming ending here in the near the toe. some meridians are starting near the toes, or this one. Okay, so when we are applying the pressure zone therapy, we are addressing all the meridians, either on the hand reflexology, hand zone therapy. When we are applying the pressure here, we are addressing all the meridians within the hands, both the hands. And when we are toe, we are pressing, we are addressing all the meridians. Okay, so now the urinary bladder meridian, it starts in the last finger and goes up to where all so many points are there. Full body is covered here with this. So this we are not going to cover vata, pitta, kapha. Okay. So now, having said this, last time we discussed about the meridians. This one, there are 14 meridians. So each one starts from the one is the heart meridian here. The heart meridian, small intestine, large intestine. That means whatever organs we have inside, for all the organs there is one meridian. Okay. So now, to keep yourself healthy, and what we have to practice is heart is the first one, heart point H9, and it prevents a heart attack, discomfort in the chest, etc. This point comes here. H9. You can see. Are you able to see here? Here the last finger है. लास्ट फिंगर के द अंगूठी के द नेल का बेस इधर है, देखो, द पॉइंट नंबर 1. आर यू एबल टू सी? आर आई एम नॉट श्योर हाउ कैन आई एक्सपैंड दिस. Okay, actually I suggest everybody to download one app, mobile app. I will tell you. Acupressure index is the name of this one is called Acupoint Index. I will type it in the chat box. Okay, so madam, you can just type it, this Acupoint Index, a mobile app from it can be downloaded from the Google Play. Okay, so this one is from this app is at least good. It is giving a good feel of the points, and it explains English name, meaning, and location, indication, etc. It will give all the things it is giving here. Okay. So now any time whenever we press this, when we are pressing like this, I'll stop sharing and comment so much. So what happens is whenever we are having we can apply the pressure here like this H9, and that also we are applying the pressure with the this also. Small intestine also we are applying the pressure, both together. But mainly heart meridian means H9, we have to apply the pressure. And then after that, when it comes here, so this is H8, H7 will come, H5, 6, 7 will be coming here at this point. Okay, so that I'm going to show it there. Last time I explained like this, heart point and then lung meridian will be coming here. So that saves a lot of, saves life. So once one of our colleagues he was profoundly sweating when and he was almost fainting at that stage. So I went to just remove his belt, loosen the belt, and then remove the shoes. And that is the first aid. When we are doing the first aid, we have to do that as a precaution. So for loosening of air, breathe, etc. So then we apply the pressure here on the H9 and lung meridian here. The lung point will come here. When we are applying the pressure, like in zone therapy, when we are applying the pressure here like this on both these things, immediately they will revive. The heart pumping will start, and this works as a first aid. Even if a person gets heart attack, immediately when we press this one while taking to the hospital, there were several cases. Some of our colleagues, friends have told that person got the heart attack and then he was taken to the hospital. While going in the car, they were pressing this point. The symptoms have vanished and it became normal. And my own colleague whom I did this particular thing, he was making a presentation to us, and when he was fainting, I pressed these 2 points, the heart point and lung meridian point, and here that apne aap, when we are pressing ourselves, we can do like this, both with the thumb as well as this one. Hold like this near this line here and apply the pressure. With this, what happens is immediately we are able to do ourselves. When we are practicing these points as a precautionary level daily, 7 times when we are applying pressure here daily, there is no chance of getting any heart problem or heart attack or etc. But after coming the 14 times, we have to apply the pressure till the heart becomes normal, function becomes normal. And meanwhile, keep checking whatever the allopathy or doctor's advice is required, keep doing it. As I said in the beginning, this will also goes along with the people, allopathy or any medicine, medical system, it will go along with this and no side effects of that. So my colleague has told, he was admitted to the hospital on the same day. Then he told that another heart attack was averted. So then he thanked me a lot for that one. So another example I want to share for this zone therapy as well as this one zone therapy, where it will be useful. Same person who is my colleague. Uh, by the time I came to office, he comes by bus. Just before 9 o'clock, he will reach. I reached office by 9 o'clock, 9:10 or something. Security see later, security person. Then in the lift, and then in my division mein, beginning mein, our office ka secretary, everybody was asking, SS Rao, your boss is looking for you. Where are you? Why you are late? That 10 minutes late ke liye. So then he was trying to demonstrate, another colleague is there. He was trying to demonstrate, saying that my fingers are not working since morning. So they did all Amrutanjan lagaya or pain bomb, then the hot water fermentation, everything they did, and he was doing so many things, but he could not do. And he has to come to the office and go to the clinic in the office, in ISRO office. So doctor is yet to arrive. The doctor's bus is yet to arrive. So he came to the seat and then he was looking for me. So unfortunately, I was late by 10 minutes. So that time, the moment I reached there, so I just saw the hand is cold. पूरा ठंड पड़ गया उसका hand. That means यानी blood circulation has stopped in the hand. So immediately I started with this little finger and applied the pressure 14 times. And next finger, this is a triple warmer, Vata Pitta Kapha. This is heart and small meridian. And just like in zone therapy, I was explaining, I pressed this like this. And then this triple warmer, Vata Pitta Kapha. I am applying the pressure here 7 times, 14 times. Then this is the pericardium. So this middle finger is a pericardium finger. So I applied the pressure here and I did just this one. And I pressed these 2 points here. And pericardium 6 comes here. Pericardium 6. After applying the pressure, I just went to my seat some 10 feet away and then came back with some other points. But by the time he was able to lift his paperweight and hand has become warm, and he's able to lift the paperweight and he's showing it. Till then, my other colleague also is astonished. Hey, what, Rao, you have done the magic. So this is the power of acupressure. It's not that my magic or whatever I have done. It is a power. So what happens is even a layman can do this. So simple. And if you are applying the pressure so much very hard, if you are applying, it pains here locally. And we call it pleasurable pain. सुखदायक दर्द और आनंददायक दर्द, आह्लादकरदायक दर्द, क्या बोलते हैं. So if it is too light, if you are applying, there is no effect. So थोड़ा दर्द होना चाहिए इधर. So you apply the pressure here like this. Whether you call it zone therapy or reflexology or your meridian points, anything, this is number one life-saving point. Number one life-saving point is H9. Okay. So then coming back to the share, as I told you, H9 and then H8. Here is H8 is also flows like this. In the reflexology, heart meridian is is falling in this area. In reflexology, heart is falling in this area, and meridian is also going from the reflex point, heart reflex point. Then You see here H7, 6, 5, 4, all these points are very close. That means in the line of last finger, when you hold like this and apply the pressure here, you are activating the heart. So you can apply the four like this with all the four fingers. Anything, this will help a lot. Okay. So this is about the heart point, number one. Any doubts on this? Do people want to practice it? Or shall I move on to the next point? This also addresses high BP is H9, low BP is H9, CV17. Okay, CV17 I will show you in a minute. So GV20 comes here, the governing vessel. GV means governing vessel. So that comes in the middle of this line here. If you draw the line from this here, so to the like this, exactly the middle. Brahmarandra bolte hai na? Brahmarandra.
सर इसको हटाएंगे
That is
तब
the
समझ
point
में
to
आएगा
GV20.
सर
So just apply the pressure here. It will be soft for the children. It will be very soft. Like don't press there for the children. So you know the as mothers, you know, this is hard for us. So we can apply the pressure. This GV20. This is a cluster of so many points here that works like a miracle for many problems.
Sir, if you remove this slide, na, then we can see you.
Oh, sorry. Okay.
Yes.
Okay. So GV20 comes here like this. The middle from here it comes. I will show the meridian itself. Just give me a second. This is called the governing vessel. GV20 here is the top of it. This is Brahmarandra point. Was I not sharing? Sorry. I thought I'm sharing in the picture. So this is the GV20 here. Okay. So as I told you, this governing vessel goes all through the spinal cord here. And when you are applying the pressure here, and it also ends here at this point. Okay. So this anybody is getting a faint. Somebody fainted. Actually, when we are working in AC lab, computer lab में किसी को he got the boy fainted, 25 years old boy, because of the chillness he fainted, and somebody was trying to find some key bunch and all, something they were trying to put it in the hand. Just I pressed here, I went and pressed this point. This is the end point of GV, governing vessel. That is a GV27. You can see here this point, GV26 point, just below the nose. Okay, and this is the top of the point is a GV20, and the CV also I will show you, and then I will stop this one. Now the CV20, that is a conception meridian. It starts from here. It starts from the lower. The governing vessel ends here. Conception vessel starts from here. Okay. So you remember these points, CV22 to CV1. Okay, CV1 comes near the below this one up to CV2, CV3. This line you remember. I am going to explain one very beautiful technique for this. Okay, so now what I am trying to say that heart meridian for high BP, when the people are there, just press the H9, and low BP you have 3-4 points. One is a heart meridian, H9, and CV17. CV17 is conception vessel में point 17, where near the rib seat comes. Near the rib seat will be coming. So that is a CV17. Those 2 points you can see. You can play around the video and then see that one. The points I will share here. And GV20, and this one high BP and low BP ke liye H9 and CV17. And I will show you the CV17 also here. CV17 is coming here, just near the heart and in these nipples line. If you take it, say in between that comes here the CV17. So this is for the lowering the BP, low BP. Then we have covered heart related mainly, and then pericardium 6 will come now. So for this large intestine is LI4, which is near the web of this one. It's a large intestine, starts from here, index finger it starts, and the LI4 is this point here. So I'm going to, that is hyperacidity, constipation, vomiting, etc. So LI4, LI4. You can see here are you able to see?
Yes, sir, we can see.
So this is the point here, LI4. This comes here. This is a Sarvaroga Nivarani point. I am telling Sarvaroga Nivarani points. H9 is number 1 point. Okay. This LI4 is number 2 point. Sarvaroga Nivarani. Sarvaroga Nivarani means many diseases can be prevented and cured with these 2 points. There are 7, 8 points I am going to explain. They are the points here. Okay, so many things are there. You can see the below in the app, once you download, you can see here that its name, location, position, and indication, etc. are giving indication. LI10 is numbness in the pain in the hand, motor impairment, upper extremities, and other this one like this. No, it has been explained very beautifully in the app how to do that one. So people can use that thing. And this is LI1, large intestine 1. And when I was talking of the zone therapy, the point is coming here, the nail thing. That's why the zone therapy, why I'm insisting on so many times, is either starting of the meridian or ending of the meridian is happening near the nail base of the fingers, toes and fingers both. So applying the zone therapy, if you just do the zone therapy without knowing any other techniques or any other organs related, reflexology zone therapy will wonder. It makes a lot of wonders. Okay. So then next point is, any questions on this? Yeah, this is the LI4 is for hyperacidity, constipation, and stomach. Then vomiting and stomach. That is stomach 36, tiredness, leg pain, stomach problem, etc. Then this is stomach 36 comes 4 fingers down of knee joint. I'll show that. So you can see here stomach 36, stomach 44 you see here first. Stomach 44, it starts, stomach, the last 45 will come here in the second toe. Second toe outside, the near the nail base. Then goes to the 44 is the first web there. That is a gap will come. Then 36 will come here on the second thing. At near the from 35 here to here it will be coming. Stomach 36, 4 fingers. You can see that picture very clearly. This is one of the best points where digestion, indigestion, then acidity and all. So when we apply the pressure in stomach 44 and liver 3, I'm going to cover. Next one, next line near the thumb line is this one. If there is a nausea, vomiting sensation, but vomiting is not happening, just apply the pressure on stomach 44 and liver 3 points. Liver 3 comes here in this web. Okay, so these 2 points, immediately vomiting will happen. Okay, so next one, spleen 1 and spleen 6. This is for the diabetes, menstrual problems, excess or scanty or premenstrual syndromes, then sciatica pain, varicose veins, etc. These 2 points will help, spleen 1 and spleen 2. This is actually it's SP1. It is called the pancreas, spleen and pancreas. It is called both. It addresses both diabetes also. This is very, very important points. These two. So I'll just share these points here for you. So this is the thumb ka outside point. So that means for foot inside, thumb this side point near the nail base is spleen 1. And here from this ankle joint, 4 fingers you can just apply. 4 fingers like this, your fingers, not others' fingers. Because person to person, the finger width will change. So whoever is having problem, for anybody, if you wanted to press, their fingers we have to take and ask them to put it there and then measure that. That is the right way of doing it. So 4 fingers from ankle is the spleen 6 here. SP6 you are finding. That is spleen pancreas 6. These 2 points makes wonders for diabetes, mood changes, mood swings, then the menstrual problems, menopause problems, so many things. Even for headache, spleen 1 also works. Then next one is kidney 3 and kidney 6. This is kidney point. Say most of the times these kidney 3, kidney 6 points, please remember, they are required to flush out the toxins. After you do the acupressure, as a last points, you apply the pressure for the kidneys. Wow, where there's the ground. Any doubts on this so far? You can just ask. Meanwhile, I'll kidney meridian. I will get. So this is a kidney 3 point here. What it shows here is this is the area between the ankle and the last line of this nerve here. Behind the foot area, just above the foot area, behind this area, K3 it is called K3, and here it is K6. Here it is below that point is K6. These are the 2 points around the ankle. And removing the improving the kidney function, improving the eye functioning, and hearing function, etc. K3, K6, K7, etc. are there, but those things are specific. But on a regular basis, K3 and K6, if you are pressing it, so kidney functioning will improve. Lung 1, lung 9, lung 7, and bladder. So these the severe breathing problem, everything will be addressed here. When we hold our hands like this, I'll show you lung, meridian, lung. So lung 11 is starting from the thumb of the nail base outside. It starts here, and then lung 9 is coming here. Okay, so these are the 2 important points as I was mentioning, like this here. So I'll stop sharing. And you can see I'll show again this the kalai pakat ke press karna. Just I was telling no. So this lung is starting from here and then goes here. When we hold here, the thumb, lung 1 and lung 2 will come. I will show it short while now. So this also helps, and there is one bladder point, B13, and lung 9 and lung 7. So B13. So here what happens is when we are holding like this comes lung 1. We keep horizontally hands, bring it like this. The thumb wherever it comes is thumb 1. Slightly below is lung 2, lung 1 and lung 2 points. These are the one. And when we are going it, so lung 11 is this point here, the nail ka pass. Then lung, this one comes. 7 is here. Where is the 7? So lung 9 is here. So it will show lung. So this lung meridian. So these are the points it will go here. Okay. And the 10 and 11 are also very important points here. We can see here. And these are the 2 points which will help a lot. And there is B13, that bladder 13. Just hold your hand like this and the middle finger, and then this should touch the neck here. The thumb should touch the neck. And when you are putting it here, the back side, the point wherever the middle finger touches, that is the point where you can press this one for immediately. There will be relief of heavy breathing and asthma attack, everything. So once near our apartments, there was a midnight 11 o'clock. One person midnight around 1:30, he was having a severe asthma attack. So immediately I went there and held his points here. That like this, we hold like this when we are holding a shoulder in the clavicular area here. The shoulder point comes. Hold like this, and then thumb will come at the back side. So when we hold like this and press with the thumb and press and release like this. Our self-help means like this, you have to apply the pressure on the back. This will immediately give a relief. And also this lung 9, lung 11, and this 10 and 11 will be coming here. So these are the life-saving points. As I mentioned to my colleague, when I was pressing this one, these points, heart and this one, immediately he told, after going to the hospital, next day, he told me, Rao, you have averted my second heart attack. Okay, so this is the power of acupressure. So people can know. And one or two more points, I'll just share it. We can't cover everything in one day, one session. So also that is for the protection for the heart point also. Pericardium starts from this middle finger here, and then it goes outside here. So the between the two bone joints it comes here, and triple warmer comes from the ring finger and comes inside of this inside between the two bones. So this I am going to show these points. Here SP6. You see pericardium 6 and pericardium 9. You can see here pericardium 9 is starting from the base of the nail here, and then middle portion backside of the nail here. This one you can see here, P6 point. So this is one of the very important points. And similarly, triple warmer starts. A triple warmer 1 start. This is Vata Pitta Kapha for cough, cold, fever. For many things we can use these things. Okay, triple warmer 1 and also triple warmer 5 here. You can see the triple warmer 5. So this is triple warmer 1 and this is triple warmer 5. This is pericardium 9 and pericardium 6. So these are very important points for well-being on a regular basis. Okay, so then CV walk for fatigue and triple warmer 5 for the fever. So when even for a high fever also, Annapurnaji has asked the triple warmer 5 will come here at the inside of this one. So between the two bones, joints, it will come triple var must 5. When high fever is there, and triple var or 1 also we can use it for this one. And pericardium 6. And knee pain points, stomach 36, spleen 9, K10, and headache. So this I'll just show you now. So, and the CV walk I am going to explain. I was telling this particular point, CV walk. Remember from 22 points, that means from the near the throat from here, when we go down up to the navel, below navel, up to it just straight away goes up to the urinary tract up to that point. And the point number 1 will come below the perineum side, it will come. So here, when we just walk with the 2 fingers from the top to bottom, or rather the CV22 onwards. When we have to go for motion, we're not happening, motion is not happening. Just apply the pressure here. Stop it. When motion is not happening, apply the pressure here. Okay, so and when somebody faints, apply the pressure here. Fits are coming, apply the pressure here. Okay, faints. This is GV27, 26 it is, and CV1 here. And then from CV, the next one, this is just, I have shown you the point there. Just walk with the 3 fingers here. Apply little pressure. You don't have to do much thing. When घर का काम करके करके पूरा थक जाते हैं लोग, and they can't even move, they get lot of fatigue. Just apply the pressure here like this. Within 2 minutes, they will get up and then have their energy is regenerated. Practically, we have seen with several people with this particular thing. So once my somebody, the sister, actually she was unable to. She got a lot of tension, fatigue, and unable to go out. Then I just asked her to do this. So immediately within 2 minutes, she rejuvenated, and then happily she went out. There was absolutely no problem afterwards. That so instant reduction of this one. So did I answer all the questions? And stomach points also, okay, that is pending. Right. For knee pain, we said stomach 36, SP9, spleen 9, K10, and headache. So these points already we have covered here. So I just so stomach 36 and spleen 9, where they will come. This is SP6. The spleen 9 will come near the knee point. Near the knee point, it will come. So this is stomach 36 is 1 point here, just with 4 fingers below this knee joint, and stomach 35 also we have to press here for the knee pain and arthritis. And there is one more point which comes here for the knee. Spleen 9. SP1, SP6 are given here. And also the gallbladder point 43, on a maintenance point here, gallbladder 43, you have to apply the pressure. So this is one of the important points. And also gallbladder 44. This is the root of the nail of the from this finger, 4th finger. So in the zone therapy, we are addressing this point. And this point also will help a lot for the palpitation, headache, and vertigo, swelling in the cheeks, and GB42 meridian bones. And then GB1 is for the eye also we use, and ear also we use. Hearing problems and eye problems, this GB1 at both the places we apply the pressure. Okay. So the stomach 36 we have seen, and what else? So this is just around all these points are falling around the kneecap area. The heading is above the kneecap. K10 is left side inside of the kneecap. Stomach 36 outside the kneecap, 4 points down. Spleen also below the 9. Okay. So with this, probably we have covered today's agenda, and some other time we will.
Yes, thank you, sir.
So finally, what I want to suggest everybody is this: I'm happy, healthy, wealthy, slim, strong, and fit. Keep repeating this. Okay, while applying the pressure in the hand also, and while applying both the hands and this one. And zone therapy, as you have seen, all the meridian points ending or starting is the zone therapy. Apply the pressure on all the fingers regularly. Okay, once in a day or twice in a day, you can apply the pressure here. And take care of that the food after the food 2 hours, and before the food anytime you can do. And the swiso exercise, you are applying the pressure on the swiso exercise on the fingers, which are all the head area, and everything is getting pressed. And then they will be activating all the zones, also activating, and all the points are also getting activated. All the meridians also are getting activated. So with this, Sarve Jana Sukhino Bhavantu. So I conclude. Thanks for everybody's patience to listen and encourage me. And probably when we are posting this in YouTube, make it 2 parts of 1 hour each, and then we can post. So instead of 2 hours continuously watching.
Thank you, sir. Thank you, Srinivas, sir. You also made such a huge effort to present all these points to us. And I will only request that many people had some questions. You can go to that part of video and see it again so that it will be more clear to you. So thank you so much.
What I'm thinking is that I will share the feedback form, and people can put the doubts also. They can give the feedback also, and I will collect and have points, more specific problems we have to address. We can see meridian points we have to go and then apply. Otherwise, everything that regeneration will happen with the reflexology points. Thank you.
Thank
God
you.
bless you.
Thank you, sir. Thank you, sir. Thank you. Thank you. Thank you.
Thank you very much,
Yes.
sir.
Thank you, sir.
Thank
Thank
you.
you, Madhulin, Annapurna ji, Ranjita ma'am. पूरा 2-2.5 घंटे थे. Sir, thank you so much. Prasad sir, thank you so much.
Thank you. Thank you for everybody for staying back for this long.
Thank you.